Since being awarded the Vanguard over the last 6 to 8 months, our effort has very much been about trying to understand where practices are at in terms of their workload. So we've been going through quite a hefty engagement exercise, primarily to listen to practices, but also to really understand where we're starting from, because before we start changing anything through the Vanguard, we really do need an understanding of the dynamics at play within practices in our county. The activity and demand work that we've done has certainly opened up the conversation about how practices match the patient need and demand against what that practice can offer. And certainly through the Vanguard, I'm excited that over the next year, I hope that we can start actually bringing some real solutions to that. The feeling is that there is a real openness there amongst practices to solve this problem that's going to be best for patients. The challenges we have in primary care are that we have 44 practices and they're all separate businesses, and for many decades general practice has had a very strong model, and particularly in our county, general practice has been very strong historically, strong in terms of quality but also strong in terms of collaboration and openness to new things and new ideas. It is very much a challenge for us to make sure they all have a voice. But at the same time, we need to bring leadership into the system and help them then understand, well, how are they going to have a united voice for our county in Northumberland? The greatest achievement, in my view, is that we've actually done an effective activity and demand analysis across the majority of practice in our county. And we've actually started to then think about how our patients are using emergency departments, the ambulance service. And I think it has opened up some very interesting conversations. I think the Vanguard programme, for me, it talks about relationships actually. The relationships that are being built and are growing from strength to strength between primary care, secondary care, community care and other providers, I think is an extremely productive and positive way forward. There are some real challenges in terms of the questions that we need to answer, but I am very hopeful that actually with all of us working together we will be successful.